My name is Dr. Michael Baratz. I'm an orthopedic surgeon. I specialize in hip and knee replacement surgery. My primary practice is in Milton at Beth Israel Deaconess Hospital-Milton, but I also spend about 1 day a week down here in town at Beth Israel Deaconess Medical Center. There are many options on how to treat hip and knee arthritis, starting from conservative care all the way up into surgery. My philosophy is to present those options to every patient and let them pick what they think is best for them. So I see patients of all ages. The majority of my patients are in that sort of baby booming age right now, 50s, 60s, 70s, sometimes older, but occasionally patients who are much younger need joint replacement surgery all the way down into the teen ages because of some sort of systemic illness. So I don't really have an age cutoff of my patients, but the majority of them are in that 50, 60, 70-year-old window. One of my areas of focus has been revision surgery, patients who need a joint replacement redone for various reasons. There are times where a joint replacement will fail for mechanical reasons, infection, or persistent pain, and I have a big interest in doing revision surgery. Approximately 30 to 40% of my practice is revision work. I love what I do. I really enjoy being able to take a patient with a distinct problem with pain or poor function and take that patient's life and turn it around, give them a better functioning joint, get rid of their pain. When it comes to patients that require revision surgery, I really feel like those patients can be often the most desperate, and taking their problem and fixing it and giving them their hope and life back is extremely satisfying to me.